हाय, हाउस ऑफ वेलनेस के नए एपिसोड में आपका स्वागत है। आज हमारा वर्ल्ड नो टोबैको डे पे स्पेशल एपिसोड है। Every year, 31st May is observed as World No Tobacco Day to create awareness and draw attention to the tobacco epidemic and the preventable diseases and deaths that it causes.
I take great pleasure in welcoming Dr. Prasad Kasbekar, who is a Mumbai-based consultant cancer surgeon. He has done his MS and MCH as well as his training in advanced cancer surgery. He's currently practicing at various hospitals in Mumbai, Bhatia Hospital, Wokhad, Holy Family, Masina, Apollo Spectra, St. Elizabeth Hospital, to name a few. Welcome, Doctor, to our show.
Yeah, thank you. Thank you for inviting me.
So, Doctor, my first question to you is, tobacco हमारी सेहत के लिए कैसे हानिकारक है?
So basically, tobacco जो है, it is one of the most beautiful drugs ever created. You know, you name the disease and tobacco causes it. It is something like that. So, abhi, for example, tobacco has been associated with, heart disease. Everyone knows about that. Basically, in brain strokes and things like that. Also, it is associated with surprisingly a lot of cancers. And if some studies and all were done on tobacco, and they found out that tobacco products basically can contain almost 60 odd compounds which are, known to cause cancer. And I think an association has been proven with almost 8 to 10 of them that these substances definitely cause cancer. The worst part about tobacco is tobacco causes addiction. So people cannot, control themselves once they start using tobacco products. So in that sense, it is something that I think people should be very aware about. And, if you know someone who is a tobacco consumer, you should try and get him addicted as soon as possible.
Okay. So what you said that it causes a lot of cancer. So what are some of the cancers which are associated with tobacco consumption?
So actually, tobacco is known to cause as many as 16 cancers in the body of different types.
Oh.
But the main ones which, I think are health hazards in India especially are basically the oral cancers or all the mouth cancers. These are most common in this country. Along with that, your voice box cancers, such as larynx cancers. So these are more in people who are known BD smokers or cigarette smokers. Lung cancer is also a very common cancer in India, as well as your bladder cancer. So these four cancers, I think, are the biggest health hazards in terms of tobacco consumption. And especially, Maharashtra and Gujarat are known as the oral cancer capital of, India, where I think every year at least maybe more than 10,000 people are detected with oral cancer.
Oh, so talking about oral cancer, doctor, what are the signs and symptoms of oral cancer?
So the most common sign and symptom is some sort of an ulcer in your mouth. कोई भी ऐसा छाला बन जाता है मुंह में, that does not heal to your, normal medications and things that you try. Mostly ये जो छाले बनते हैं ना, it is painless. So that is one very, dangerous factor that you should see. If it's a painless ulcer in your mouth that looks very innocuous or very, harmless, that can cause problems for you. So this is the most common. Many times, while brushing our teeth and things like that, you might notice that one of your tooth has become slightly loose, has started shaking. One of the other things is, bleeding while you brush your teeth or something. So these are very innocuous early symptoms that you could be having an oral cancer. Other more advanced symptoms include, you get swellings in your neck. That is when your cancer has spread from your mouth to your neck. So these are the things you should be looking for in, oral cancers, basically.
Okay. So what are the signs of and signs and symptoms of laryngeal cancers?
The most common sign or symptom is your change of voice. So normally people present with a sort of a hoarseness of voice or that irritation where you keep, trying to clear your throat, Many of these patients keep doing that. And then you tend to, take it as something innocuous, kuch to aise, sardi ho gaya type of attitude. But that can be the first sign, especially if you're a smoker who has suddenly noticed a change in voice or something. This is the first thing you should go and get yourself tested for. Ki just ensure that there's nothing wrong with your voice box. As any cancer in your mouth, basically the first tendency is to spread to your neck. Neck has this fat in your neck which has got something known as lymph nodes. So that is the first place it spreads to. So generally, some people may not have any symptoms in their mouth, but may just notice some sort of a random swelling in the neck. So these people also should go and get themselves tested.
Okay, okay. And what are the signs and symptoms of lung cancer?
Lung cancer is actually one of your most dangerous cancers because it gets detected a little late. Mostly many of these smokers and all are asymptomatic when they have a cancer harboring in their lung. The normal first symptoms that someone would expect would be something like, coughing, or sometimes, in the more advanced stages, they have blood in their cough, basically. So they're coughing out blood. Sometimes the more advanced lung cancers can present with a sort of a chest pain, which is very, continuous kind of a pain. So this is one of the symptoms of lung cancer. Other symptoms, can be breathlessness, sometimes especially on exertion, wheezing when they try and talk or exert themselves. So these are symptoms they should take seriously, especially in those who are who have a history of smoking and tobacco consumption.
So, doctor, before I ask you about the bladder cancer, I'm very, very curious to know. मैंने कितने लोग से बात किया है जो गुटखा खाते हैं और मैं जब बोलती हूँ कि हार्मफुल है तो बोले ये टबैको नहीं है, ये तो गुटखा है. So can you throw some light on that गुटखा?
गुटखा बेसिकली टबैको ही रहता है. टबैको के साथ वो कुछ और चीजें उसमें मिक्स कर देते, वो चूना और बाकी सब चीजें, वो सब मिक्स करके वो गुटखा बन जाता है. तो अभी ये जनरल एक्चुअली उसमें क्या है ना कि majority of our गुटखा consumers are from the lower socio-economic class.
Right.
I would consider it a more socio-economic disease than a disease health hazard per se. Reason मैं ऐसा बोल रहा हूँ कि most of these people are the daily wagers, these kind of people who tend to survive on that gutka induced, high or energy that they get. So that is something, I think people should be aware of. Ki it's very easy to tell people aap band karo, but unless you uplift their socio-economic status, that is something I think we have to look at it from that psychological aspect as well. But हाँ, गुटखा definitely एक ये रहता है कि it is one of the most dangerous cancer causing agents. और लोग क्या करते हैं, उनका टेंडेंसी रहता है कि गुटखे को मुंह में एक ही जगह पे रखते. If you have noticed, they create that pudi or whatever and they place it in their mouth. अभी जब हम एक ही जगह पे रखते हैं ना, that area gets that maximum stimulation of that gutka, and the chances of causing cancer may be, at least 5 to 10 times higher than maybe a random smoker or someone like that.
Okay. So thank you for throwing light on that, because I find that it's become very rampant. I see it everywhere.
That is the thing. So it amongst the lower strata, it is some cheap alternative to get, energy or that nicotine induced high that they get.
And what about signs and symptoms of bladder cancer?
So surprisingly, actually, the story behind bladder cancer is not why people will wonder why a smoker will get bladder cancer. But ऐसा होता है ना, once you smoke, all those toxins are absorbed in your blood. And then from your blood, basically it goes to your kidneys where it's excreted in your bladder. And उसमें क्या है, कुछ aniline और वो सब ऐसे agents रहते हैं जो when we have a tendency to store our urine in our bladder, you don't immediately evacuate. So that basically stimulates the bladder and causes cancer over there. अभी ब्लैडर कैंसर का मोस्ट कॉमन सिम्टम है पेशाब में खून यानी हेमाटूरिया, जो ब्लड इन द यूरिन. So that is the most common symptom, and that is the most scary symptom that people might notice, and everyone who notices that will more often than not go to a doctor. But other small symptoms that you should suspect is sometimes people are very often burning during their urination, which is very, they tend to take medications for it. They tend to do things, but it just get recurrent burning. Even after medications, they don't get relief. So that is one thing that, that should create a suspicion that they should get themselves evaluated more. Another possible things is कभी-कभी bladder cancer में कैसा रहता है कि patients have थोड़ा urine passage करने में difficulty, कभी-कभी clots निकलते हैं urine में, ऐसे थोड़े बाकी के भी symptoms रहते हैं bladder cancer.
Okay.
डॉक्टर, आपका जो सरवासा हेल्थ सेंटर है, क्या आप हम सबको उस बारे में बता सकते हैं?
So we have started a new, अभी basically कैसा रहता है ना, हम if you have noticed cancer care में आप लोगों ने notice किया होगा, since you all are very involved in healthcare, many of the patients that we have, especially मुंह के जो cancers और oral cancers जो रहते हैं, काफी जनों का काफी extensive और morbid treatment रहता है. तो morbid treatment में सर्जरी हो जाता है, उसके बाद रेडिएशन हो जाता है, उसके बाद कीमोथेरेपी भी लगती है. Many of these patients actually, उनको सब ट्रीटमेंट करने के बाद उनको खाने पीने को हजम ही नहीं होता है. They cannot eat, they find it very difficult to swallow. Basically उनका माउथ को में खाना रखने का भी वो बहुत डिफिकल्ट हो जाता है, उनको सॉलिड खाना खाना और वो सब. तो basically this center has been started with the intention of trying to provide a more rehabilitative sort of treatment. So हम लोग क्या करते हैं कि जो patients अपने पास आते हैं, we from day one only make a proper plan and a proper protocol for them to try and give them the best outcomes. So हम लोग पूरा right from prosthetic rehabilitation to advanced microsurgery to everything, just to ensure that not only is the cancer और जो भी उनका मुंह का problems है वो relieve हो जाए, but along with that post surgery or post treatment they should have the best possible life. Abhi, in fact, this is I think the only center in Mumbai, and maybe other than maybe one or two centers in India, it must be the only center in India which is doing this kind of work.
Wow. So it's holistically taking care of the disease.
Yes, so our focus is more on ensuring the patient has a good quality of life. ये थोड़ा कभी-कभी कैंसर ट्रीटमेंट में साइडलाइन हो जाता है, क्योंकि फोकस इतना कैंसर रिमूवल पे रहता है कि people don't bother about how that patient is living. Means बहुत बार ऐसा होता है कि हाँ पेशेंट 5 साल सर्वाइव हो चुका, but what was the quality with which he survived is also important. अगर just ऐसा 5 years living is not good unless he has some what do you say, quality in the way he lives. तो हम लोग का थोड़ा वो फोकस उस पे ज्यादा है कि not only are we removing the cancer, giving him whatever the levels of care that he's supposed to get, but we are putting a great effort in ensuring कि वो पूरा उसको ये मिल जाए, properly उसको rehabilitate हो जाए. So we have thought of developed a team here, which is not only the cancer surgeons, plastic surgeons, implantologists, but also physiotherapists, speech therapists, right from nutrition, diet, everything. Just from day one, we sort of evaluate the patient, create a plan for him, कि this is the way he has to be managed.
Oh, that's absolutely wonderful to know.
Yeah, so that is something this is something novel that we have started over here in Masina Hospital at Baikala. Okay. And this is something we hopefully wish to take forward.
Great. Wow.
Yeah.
Thank you so much, Doctor. The information that you have given is very, very valuable. Thank you so much for your time and your guidance.
Yeah, thank you. It was an absolute pleasure to come and talk with you all. Yeah,
thank
hopefully
you so much,
I can be of more help in the future also. Yeah,
that would be great.
Yeah, definitely.
And Sonam, time for cheers to wellness.
Absolutely, cheers to wellness.
Yeah, cheers.